Have you ever walked into a doctor's office feeling perfectly healthy, only to leave with more fear than answers? One of our viewers recently shared something that stopped me in my tracks. He's 70 years old and lives in Sydney, Australia. His doctor recommended a heart procedure, but he feels fine. No pain, no major symptoms. And now he's asking himself the same question many older adults are asking today. Do I really need this? That's what today's conversation is about. Not avoiding doctors, not ignoring your health, but learning when to ask one more question before saying yes. Because sometimes the most important medical decision isn't saying yes to a test. It's understanding why you're having it in the first place. And by the end of this video, I'll share 5 simple questions that could completely change your next doctor's appointment. The video is made for your information. If the video looks good, then quickly like the video and subscribe to the channel. I'm Dr. Matao Jamee. Let's start topic. A viewer from Pennsylvania recently wrote, "Let's just check." Then the test started. That simple sentence perfectly describes what many doctors call the medical cascade. One test leads to another leads to a procedure, and suddenly you're dealing with something that wasn't bothering you at all 3 months earlier. Most people assume more testing automatically means better health. But after age 65, the equation becomes more complicated. Some conditions grow so slowly they may never affect your life. Some procedures carry risks that become more significant with age, and some findings look alarming on paper while causing no real problems in the body. The goal isn't to avoid healthcare. The goal is to make smarter healthcare decisions. Let's start with one of the most common examples. One comment really stood out to me. An 83-year-old viewer from Mumbai shared that after years of occasional stomach discomfort, he eventually learned that not every symptom automatically required the most aggressive testing available. That comment highlights something important. Many people assume colonoscopy is the only option, but today there are stool-based tests. There are newer blood-based screening options being discussed and developed. And for many older adults, those conversations are worth having before jumping straight into an invasive procedure. The key question isn't, can this test find something? Of course it can. The better question is, will finding something actually improve my quality of life? Those are very different questions. For adults over 75 who have had normal colonoscopies in the past and have no symptoms, the benefit of repeated invasive screening may not be as clear as many people assume. That doesn't mean ignore symptoms. Far from it. Blood in the stool, persistent abdominal pain, unexpected weight loss, changes in bowel habits, those deserve medical attention immediately. But routine testing and symptom-driven testing are not the same thing, and understanding that difference matters. Now let's talk about the heart. A woman recently commented that a heart scan showed a 70% blockage. Now doctors want another stent. Yet she says she feels completely fine. Stories like this create understandable anxiety, because hearing the word blockage sounds terrifying. Most people immediately imagine danger, emergency, urgency. And sometimes those concerns are justified, but not always. Finding a blockage and needing a procedure are not necessarily the same thing. Many older adults live for years with stable coronary artery disease that never progresses into a medical emergency. That's why the real conversation should be, what symptoms am I having? How much benefit will this procedure realistically provide? What happens if we monitor carefully instead? And what risks come with the intervention itself? These are reasonable questions. In fact, they're questions every patient deserves answers to, especially after age 65. Another viewer wrote something that caught my attention. He said he's been receiving annual health checkups for years. Every year there seems to be another test, another scan, another recommendation, and he began wondering whether every test was truly necessary. That's not a cynical question, that's a thoughtful one. Because healthcare works best when patients understand the purpose behind recommendations, not when they simply follow instructions out of fear. Let's talk about another area many people never question: bone density testing. Falls are a serious issue for older adults. No one is arguing otherwise. But sometimes we focus so heavily on numbers from a scan that we forget about practical prevention. A stronger body, better balance, safer surroundings, improved mobility. Those things often reduce fracture risk dramatically, in some cases more than people realize. Simple changes like balance exercises, removing tripping hazards, checking vision regularly, reviewing medications that cause dizziness. These actions can make a tremendous difference, and they come without the side effects associated with long-term medication use. Before we continue, I want to address something I noticed in the comments. Several viewers said, "This looks like AI." Others wrote, "I don't trust AI." And honestly, that's fair. You shouldn't trust AI blindly. You shouldn't trust YouTube blindly. And you shouldn't blindly trust any single doctor either. What you should trust is evidence, questions, critical thinking, second opinions when necessary, and informed decisions. That's exactly why conversations like this matter. Not because someone online tells you what to do, but because you learn how to think through these decisions for yourself. That's where real power comes from. One viewer shared a heartbreaking story about losing his wife after a stroke. Another spoke about being advised to undergo a heart procedure despite feeling perfectly healthy. Others simply wrote, "Thank you." Those comments remind us that health decisions are deeply personal. There is no one-size-fits-all answer. Every patient is different. Every medical history is different. Every risk profile is different. That's why thoughtful conversations matter so much. Medicine is not simply about finding abnormalities. It's about helping people live better lives, longer lives, more independent lives. And sometimes the best decision is intervention. Sometimes it's monitoring. Sometimes it's seeking another opinion. The key is understanding the difference. Now, let's get practical. Before any screening test, before any scan, before any procedure, I want you to remember 5 questions. Question 1. What happens if we do nothing for now? Question 2. What are the risks of the test itself? Question 3. What are the risks of the treatment that may follow? Question 4. Will this improve how long I live or simply find something earlier? And question 5. If you were in my position, would you do it? That last question often changes the entire conversation because it moves beyond statistics, it moves beyond guidelines, and it brings the discussion back to real life. Before your next appointment, save those 5 questions on your phone. Write them on a card. Put them somewhere you won't forget. You may only need one of them, but even a single question can completely change the direction of a medical conversation. If there's one thing I hope you remember today, it's this. Getting older doesn't mean saying yes to every test. It means becoming more thoughtful about which tests truly help you. Health isn't about collecting procedures. It's about protecting your independence, your mobility, your confidence, and your quality of life. So before your next appointment, take these 5 questions with you. You may discover that the most powerful tool in healthcare isn't a scan, it isn't a procedure, and it isn't a prescription. It's an informed conversation. Take care of yourself, and I'll see you in the next video.